You can start now.
Okay, all right. So my name is Joan Labi. Like I said before, I'm a gynecologist, and I'll be talking about contraception. So contraception basically means you are uh, using a method to prevent each other from getting pregnant. Um, whether so, it does not only. I think sometimes when you think about contraception, a lot of people just think it's the woman's duty to use contraception. Meanwhile, it's not like that. It has to be a couple thing. Everybody has responsibility. So it's not only the man or the woman. And well, for if anybody who is either underage or not meant to be sexually active is here, the best form of contraception is abstinence. So also, I think I said that because I'm sure we will have some people that are, it doesn't, their religion says that they shouldn't have sex before getting married. So I've used that statement to cancel everybody out, which is, if you're not meant to be having sex, don't have it. Abstinence. So the people that we are talking to this afternoon are people that um, are not constrained in any way to have intercourse. So it means that you are above the age that you can have intercourse, and also hopefully in a monogamous relationship. But I think that's whatever kind of relationship you are, that's your choice. But those are the standards to have. Those are ideally people that we're addressing. So now, like I said, contraception is an act where you undergo some kind of process to make sure that you don't get pregnant. So, and that takes me to the type of contraception. Yeah, I mean, abstinence itself is a type of contraception. So, abstaining, making a conscious decision that I'm not going to have sex is a form of contraception. And yes, you can, it's an effective, in fact, it's 100%. So if you don't have sex, you can't get pregnant. So I can probably say it's one of the most effective contraception that you can ever have. Now, but if you decide to have sex, then you need to think about other type of contraception. So firstly, I'm going to break it down to natural method and then medical record. So under natural, we can talk about, a lot of people probably know that there's a natural method, but they don't understand what the natural method means. Now, natural method also, if it's used correctly, has over 95% chance. Sorry, over 95, even sometimes 99% success rate. So what does natural method means? So the natural method means that, and that's directed to a woman really. It means that you're using your natural cycle to know when to have sex so that you don't get pregnant. You're using some sign. The sign that you normally use, or the sign that most people normally use, is one, monitor the time of their period, and then use it to calculate when they are safe and when they're not safe. Because so if you have a constant period and your period is regular, you can almost predict when you're ovulating. And then making sure that you avoid having intercourse when you're meant to be ovulating. Those are the things. Now, but also, how do you know when you're ovulating and when you're not ovulating? And that comes back to, some people know when they're ovulating because their cervical, you have to monitor, you have to do some kind of monitoring. So it's either you monitor your discharge, because the discharge becomes very slimy around ovulation. So by doing that, you avoid sex around that period. But also, it's also been shown that as you approach ovulation, during your ovulation, your temperature goes up a bit. So that means that from the beginning of your cycle, you have to keep checking your temperature until it gets to a point which you notice that there's a difference between the previous one and this one. Now, one of the challenges with that is that, for example, in our part of the world, if you have malaria, you can't use that because obviously your temperature will go up. Or if you're a night worker, for example, like the nurses, they do nights overnight and then they come back. That stress can affect your temperature as well. So it's not ideal that you use that. when you have things that can fluctuate your temperature. Like I said as well, your stress, your stress level can affect it. So natural method is effective. The advantage as well is that it has no complication. Well, apart from if you don't do it rightly, you can get pregnant. It has no complication to your body whatsoever. So you can do it if you're a very judicious person, then you can do it, and then it has no side effects really, as long as your period is regular and then you do it well all the time. Now, that's the natural method. So apart from natural method, what other method can you do? So some people will also talk about the withdrawal method. Withdrawal method means that a man and a woman start having sex, and by the time they get to the point where the man is about to ejaculate, he pulls his organ out and then he doesn't discharge it into the woman. So now, that can be a very effective process as well. But the most important person in that equation is the man. Now, you have to trust the man to be able to do that. Interestingly, I actually have a very good friend who tells me that that is what they do. He's happily married. He's been married for a few years, and that is what he and his wife. But that needs a lot of willpower from the man. My advice is that if you don't trust the man, or I don't think you should. If you don't think that the man will, I mean, if he's your husband and he's been paying school fees, yeah. But if it's not your husband and he's not paying school fees, and you have to be careful with that, because the willpower of the man is the most important one in that aspect. So the problem with that is that the control is with the man. So you have to have a principal man to do that, and the failure rate for that can be quite high. So I will advise you that if you want to do that, you have to know what you're doing. So people that are not married, I might not necessarily encourage that. And also, some people, the problem with that sometimes is that some people actually release some sperm cells before they actually ejaculate. So, and I think that's where the problem is. How many cells do you need to get you pregnant? Just one. So, yeah, the person can come out or ejaculate externally, but has already discharged some of the sperm cells before they even ejaculate. So I think that's where that has a bit of a problem, and the control is with the man. So after leaving that, then we go to things like the condom. Condom can be male condom, it can be female condom. Condom is usually latex, it means rubber, and the rubber is worn over either the man's reproductive organ, or the female condom is almost like a condom as well. It's a condom as well, but in various sizes that a woman can wear before they have intercourse. Now, it's an effective contraception, and if it's used rightly, it's almost like 98, 99% as well. The disadvantage of using condoms sometimes is that a lot of people do not have the feeling that they're having intercourse. There's a barrier between the organ and the female organ, so that the friction, a lot of people say they don't feel it like it's natural. Now, ideally, if you're in that position, what you can do to prevent that is use the condom with a lubricant, and that helps you bypass that issue that you're having. The other problem with it is that it can break, and if it depends on the technique of how you put it on, and also the aggressiveness the guy or the couple have in the process. And when it breaks, obviously increases your risk of getting pregnant. The other advantage of condom is that it prevents sexually transmitted disease as well. So in a couple that is not married and maybe are not exclusive to each other, condom is a very good form of contraception. Even can be used in conjunction with other contraception because it has a dual purpose of preventing infection. So, like I said, the only disadvantage is that some people say that not only the man, the woman as well, they feel that it prevents them from totally enjoying the act. So I think that's an issue with that. Now, the female condom is I mean, it's almost like a condom as well, which you wear. The woman wears. Unfortunately, I can't show you pictures, but you can Google it after this chat and just look at what a female condom is. A female condom is almost like a male condom as well. You have to insert it and make sure it covers your vagina properly. Now, I think with that, it's important you wear it properly so that when the man penetrates, he's directly into the condom rather than the vagina. I think that's very important. Now, the female condom is not as popular as the male condom just because of the technicality, and also by seeing it, some people just don't like the way it looks, and the fact that they need to be putting it in, some people don't like that. So I think it's not as popular as the male condom. And if I'm sure that if I take a poll here, that has anybody seen the female condom before, I'll be surprised even if there's one person that's seen it. So now that takes us to something called the diaphragm. So the diaphragm is almost like a condom as well, but it's different because basically you have to now at the top of the vagina is your cervix. And I don't want to go into biology, but I want to believe that a lot of people know that during sex, there's penetration. During penetration, the sperm get deposited in the vagina, and then it goes into the womb to meet the sperm, to meet the egg, and then pregnancy happens. So if you can block that process by preventing the sperm from entering the womb, then you can prevent pregnancy. And that brings us to either something they call the cervical cap or the diaphragm, which you need to put into the vagina it's almost like wearing a cap for the cervix. You have to insert it in and let it cover your cervix. A lot of people might not like that because it means, I mean, if you think about, some people find the use of tampons very irritating. You're now telling them that during sex they have to put something inside the vagina and then have sex and then have to take it out. A lot of people will not like that as well. So that's why a lot of these things are not as popular. Also, the problem with that as well is that if it's not inserted properly, if it's not placed properly on your cervix, then it's not going to prevent the sperm from going in. So it has a high failure rate as well, and it's technically difficult to use. So a lot of people don't use that as well. That takes us again to something else called the vaginal ring. Now I finished with the barrier. Barrier means something you're putting to prevent sperm from moving. I've mentioned the condom, the male and the female condom. I've mentioned the diaphragm. So those are the barrier ways of preventing pregnancy. Then now we're going to the hormonal way. So hormonal can be broken down to different ways in which you take it. It can be by oral. So you have the oral contraceptive pill. It can be a patch. A patch means you just put it on your skin. It can be an injection. That means you have an injection. It can be a vaginal ring. That means you just put a ring in the vagina and that's it. So now let me talk about each one. So let me start with the vaginal ring. So there's something called the Nova ring. It's a contraception. It's called the Nova ring. A small ring, but it's made of, or it has hormone in it, and it's flexible. So basically, you put it in the vagina and stays in the vagina for about 3 weeks. So what it does is that it slowly releases hormone into your system, and basically it prevents you from ovulating. And if you're not ovulating, you can't get pregnant. That ring can stay in without causing any problem for 3 weeks. And then after 3 weeks, you can take it out. Make sure you have a period of rest for about 7 days if you want that, because if you don't take it out, you are not going to either have a period and the efficiency of the ring decreases. So it's licensed for you to take it for 3 weeks. So after the 3 weeks, you take it out, you have a break period of 7 days where you will have a period. And after the period finishes in 7 days, you put another one back. So you need to change it every 3 weeks, basically. As long as you are clean and you wash your hands, you do everything, when you put it in, it does not have any risk. As long as, hello, can you hear me? If you can hear me,
yes,
right.
I can.
As long as you wash your hand and follow the sterile way of doing things, then it doesn't have any risk. But if you don't do that, obviously there's a risk of infection. So I think that's a major issue. Now, the hormone, I'll cover their side effects or the issues with them together. So I'll just run through all of them. So you also have the injection. The injection is very common. I'm sure a lot of people might know the injection. A lot of people might have heard about Depo-Provera injection, which you have every 3 months. It's an extremely good and efficient way of doing a contraception. Basically, you go to the healthcare provider every 3 months to get injection, and it's a strong way of preventing you from ovulating. Now, I'll keep on hammering on ovulation. I'll come back to that. So it's ovulation, and it prevents you from getting pregnant. Then we have the pill. The pill can be a combined pill, which is the one that a lot of people use, which is the oral. It's called the combined oral contraceptive pills. It has 2 hormones, the estrogen and progesterone. And basically, once you use it as a tablet, it just goes and stabilize or neutralize the hormone in your system. And if it neutralizes the hormone, you don't ovulate. Now, you have to understand that medication or any means that you use for contraception, there's nothing like something that's 100%. It can all fail. It's just that the percentage of failure is very minimal in most of them. Then it takes us to the progesterone only pill. For example, estrogen is a hormone that you have in people, more in women, and you can call it the female hormone. Now, it also has other things because it affects your other part of your of your body. For example, if you have a heart condition like heart attack, or you have high blood pressure, or you've had blood clots in your legs in the past, something called pulmonary DVT or pulmonary embolus, that's clots in your lungs, you're advised not to take estrogen. So in those categories of people, they can use the progesterone only pill. Not as efficient as the combined pill, but can give you some level of contraception. So it's I think based on who you are or what you want to achieve and your history, you can choose a progesterone only pill, but it's not as efficient as a combined pill. And then that takes us to something called the patch. The patch is almost like a small patch that you can just stick on any part of your body, and it can stay there for a week. You can change it every week. It's the same thing like all the hormones. It's just that the method you're using is different, so it reduces the side effect that all the other ones can give you. It's not readily available in Nigeria, but yes, if you want it, people can always order it for you. And then we have the other one, which is the implants. Implants are rod. They're like small plastic rod that you can put in somebody's hand. And because you can put it under your skin, it can stay there for 3 years. And it gently releases hormones into your system, and the hormones prevent you from getting pregnant. Now, there's no major side effect with it as well, apart from the hormonal side effect. We'll come back to that as well. And then lastly, under the hormone, we have the IUS. It's called the intrauterine system, which is in Nigeria, we have the Mirena. So the Mirena is a coil. It's a type of coil, but it's a coil that goes inside your womb. It's inserted through the vagina inside your womb, and it can stay there for up to 5 years. And basically, it releases a hormone called progesterone into your womb, so it doesn't prevent, well, it usually does not prevent ovulation, but it can prevent the fertilized egg from attaching to your womb. Mirena is one of the highly effective contraception, 99 point something percent, but also a lot of people might frown at it, especially from the religious point of view, because, like I said, it does not the sperm and egg can meet. So it forms the pregnancy. It just doesn't allow the pregnancy to attach. So a lot of people could consider that as an abortion. But I mean, theoretically, is it really an abortion? I don't know. I think I'll let that people answer that. So that's the hormone IUCD. Now, if we now go back to other type of contraception, we can now use the non-hormonal IUCD, which is a lot of people know the copper T or copper coil, which is like the Mirena. It gets inserted into the womb, stays there for about 5 years, sometimes 10 years, and prevent pregnancy from attaching. It's one of the commonly used contraception in people that have had children, because it doesn't have any major hormonal side effects. So people are comfortable with it. Now, to talk about the side effects of the hormonal one, the main one that people are worried about are weight gain. A lot of people worry about weight gain, how the hormone interfere with their periods. Their periods sometimes become irregular, sometimes become heavy, sometimes all of that. But most people are worried about the weight gain, really. But I can reassure people that not everybody on hormones gain weight. It's just a small fraction that gain weight. So it's not as bad as people portray it as. I think I've mentioned most of it, but there are also some type of contraception that we classify as the permanent type of contraception. For example, a woman might have completed her family, like had 3 children, and that's it. She knows that she's never going to have another kid or whatever. She can go to her doctor and say, "Doctor, I want to be sterilized." Sterilization means removing part of the fallopian tube or all the fallopian tube. Basically, when a woman produces egg, the egg needs to go through the fallopian tube to meet the sperm. So if you if you disrupt that process, either cutting it off, putting a clip, or blocking the hole totally. I mean, the typical way that I can explain it is that just imagine that you take Third Milan Bridge to work every day. And one day I just decide that, okay, I don't want you to go through Third Milan Bridge again. I want to go and remove a major part of Third Milan Bridge. So it's not there. So the cars can get to a point, but they can't cross that point. So that's the same with the IUCD, the sterilization. You can just block it off. But remember, I said it's permanent. So anybody that's going through that needs to understand it's not ideal for somebody that's not had children or have not completed their family. Same now. Sterilization is not 100% as well. It can fail. Excuse me. The figure we quote is that if 200 people do sterilization, it can fail in one of them. So it has almost a 99.8% success rate, but it can fail. And that is because we do that because medical legally, you don't want to tell somebody that it's 100%. If it fails, you don't want them to come to you and say, "Hey, but you told me that it's 100%. So that's one issue. Now, in as much as it can do sterilization, a man can do sterilization as well. So there's something called vasectomy, which is so when you want to do sterilization, it's a bit more technical because you have to put the woman to sleep, because you have to go through her tummy wall to get to the womb. So it's a procedure, and there needs to be a form of anesthesia, whether general. I heard they do it under local in India, but I can't think about that. It's usually done under general, and then we find your tube and either put a clip on it or cut it. Now, the other procedure, which is the male version of it, is called vasectomy. Vasectomy is easier and more efficient than female sterilization. Why? Because the failure rate for that is 1 in 2,000. So it means that if 2,000 people do it, it can only fail in one person. So if you look at that, then you can argue that, why would a woman go through that when a man can go through it in a relationship? Now, we're talking about women and men in relationship. How about if they're out of relationship, then it's their decision. But it's considered irreversible. Once you do the process, then it cannot be reversed. You have to think about it properly before you do it. So And the good thing about the male sterilization as well is that it is not, it doesn't need general anesthesia to do. You can just walk into the hospital or the urologist. They find that tube that brings sperm sorry, I'll use this term. I'm sorry to use it, from the scrotum to the penis. So all they need to do is cut that area or tie it off so that the sperm cannot get there. One of the typical questions I get asked is that, so what happens to the egg? Or so what happens to the sperm? So these structures are part of your body. They are protein. So if you don't use them, so don't, I think sometimes when you say egg, some people are thinking about chicken egg. They are thinking about the size of chicken eggs. No, it's not like that. Human eggs, you cannot even, the way it's so tiny, you cannot see it by your naked eye. So it's extremely tiny and it's protein. So it means that your body can absorb it and eat it up and then continue with it. So it's not dangerous. It doesn't get stored anywhere. It doesn't cause any harm and stuff like that. So I think that's important to know that. What are the side effects? Some people that go and do sterilization early sometimes regret it. For example, let's say you are married and you think that you're done and you do the sterilization, and then one way or the other you meet another man in the future. Let's say your relationship went down south and you meet another man and you want to now conceive. You can start regretting that. But you remember that the tubes are not needed for IVF processes. So if you think that you still want to get pregnant after doing sterilization, you can always look at the IVF process. But for you to go through sterilization, you have to know that you want that process. If you're not ready, please don't do sterilization because you will definitely regret it. So I think I've covered most of the contraception in brief, and I think the most important thing is maybe start looking to answer questions. I think I've really covered most of the contraception. So I've talked about the pill, I've talked about condom, I've talked about the injection, the implant, and the patch. I've talked about the hormone, the IUD. I've talked about progesterone only pill, and I've talked about the male and female sterilization. So thank you very much. I think I've covered most of the
Thank you
types.
so much, Dr. David. This was very impactful. Thank you so much.